How has COVID-19 changed your nursing practice and setting?
COVID-19 has changed everything in my practice and in my setting. Nothing is the same, I would say. I started my career when I was a nursing student working as an orderly in a long-term care home. And already at that time, my very first job was in 2000. And already at that time, I felt long-term care felt understaffed, underfunded. So when I volunteered to go back in long-term care to help in a center with one of the worst outbreaks in Quebec right now, I thought intellectually that I could imagine how it was, but nothing, absolutely nothing could have prepared me for what I saw there. It's been an extremely challenging time, and I hope that'll really push us to change the way long-term care is given and how long-term care workers, nurses, orderlies, even maintenance workers, kitchen workers, how we're treated and that we're listened to. We cannot forget about the most vulnerable, and we had that data at the time in March that the most vulnerable were those older people with comorbidities, so other diseases, other health problems. And where are those people? They are all, well, not all, but many of them are in long-term homes. That's what long-term homes do. They take care of people who need many hours of care per day. So that was a very, very difficult thing to be faced with, to speak to my colleagues who knew exactly what was happening and who were not allowed to take the precautions that their clinical judgment, that their experience working in this milieu. Healthcare professionals, we have very important things to say. Our clinical judgment, our experience is fundamental in getting a proper, accurate picture of the situation on the ground. And without our voice being heard somewhere, we end up with situations like this. And Quebec is currently the epicenter. Montreal is currently the epicenter of the pandemic, and our long-term care homes are by far the most affected. 3/4 of our deaths have happened in long-term care. So that's a very difficult situation for both staff, families, and residents themselves, obviously.
What is your best advice or key messages for nurses working in long-term care? And what have you implemented to practice self-care?
Self-care for me is advocating for change in health and social policies and changes in our work, in the conditions of our practice as nurses. So that for me is self-care. That gives meaning to what we're doing right now. That gives meaning to my research projects that I'm involved in. And it also helps me avoid that feeling of powerlessness. I try to act politically, I try to act socially, and that is really for me the best self-care, because it helps me gain a certain feeling of control over conditions where normally we feel completely powerless. So it opened up a good discussion with my coworkers and my colleagues about how important it is for us to have protective equipment, how it's not just a question of human rights, but it's a question also of the value that we have and the importance of us as caregivers and what we do on a daily basis. I think it also helped move forward, not in fear, but move forward in determination, and help us understand our worth, really, because the work that we do is incredibly undervalued, and the biggest danger for that is that we get contaminated by that undervaluing. We have to keep in mind that what we do is incredibly important, even though we don't always feel like we're getting the recognition that we need and that we deserve. So that's the main thing for self-care. But I would also really encourage my colleagues to get involved in policy actions, social justice action, whatever floats your boat, as they say. But being involved with others, fighting for justice, getting involved in helping improve our working conditions, the conditions of practice for all nurses, for orderlies, for all our colleagues, for everybody who's working and living in long-term care, really helps with morale, really helps protect us from all the negativity that we see out there, and it helps us keep guilt at bay, because it's very easy to fall into that sort of dark cloud of guilt and could I have done more? Could I have skipped my break? Could I have, maybe gone to the bathroom one time less and made sure that I did this and this? Because when you're chronically understaffed, it gets very, very difficult to live with the choices that you have to make sometimes. So it's really important to do teamwork. That, if you're really missing a lot of staff, you have a team meeting, you try to set up a plan, and then you try to implement that plan. And, there's always something that happens in the middle of shift that changes everything. But, understaffing is not our fault. We're on the front lines. We're doing our best. We can't be caring for patients and at the same time worrying about, who's going to be called, who's going to be coming in for the night shift or the day shift or whatever shift is next. We don't have the tools, and it's not our responsibility on the ground. What we can do, though, is make sure that us and our colleagues have the tools that we need, the protective equipment that we need, and that we try to really help our colleagues not feel guilty about things over which they have very little control over. So we can speak out, we can support each other, and we can try to get involved in political actions or committees or whatever that helps us change that over which we have little or no control.